Hey YouTube, I'm Dr. Daniel Kaplin, and my mission is to make psychology accessible to all. In today's video, we're going to talk about the historical developments in the treatment of psychological disorders in children and adolescents. What we will see is we will move from earlier or more primitive approaches to a science of mental health treatment. And we will start talking about the Greek and Roman eras, and we will move to current developments. But without further ado, let's talk about the history of childhood psychopathology. So, if we were to go back to ancient Greece or Roman societies, there was a general belief that any person who had a physical or mental disorder was an economic burden on society, and it caused some level of social embarrassment. So, how were people treated if they had a physical or psychological disorder? Well, here was the mindset: they were either scorned, neglected, or abandoned, or sometimes put to death. Another thing that is important to understand about ancient Greece was the adherence to a supernatural model of mental illness. And that said that mental illness is caused by some form of a supernatural defect, things like being possessed by an evil spirit, or a person might be viewed as possessed by the devil. But there was a common practice at this time called trephination. And trephination was the process of drilling a hole in a person's skull with the intent to create an opening that evil spirit could leave that person's body. And if you Google trephination, you'll see a whole host of skulls that had a hole in it. Now, I mentioned to you that a lot of people were put to death due to mental illness. And one of the causes of death was this practice of trephination. Now, that's one practice. What if this evil spirit was stubborn and it didn't want to leave this child's body? Well, there was another practice called exorcism. And I'm sure many of you have seen the movie The Exorcist. But this practice occurred even prior to modern Christianity, in which a priest, a shaman, or another form of a clergy member would use spiritual practices to attempt to coax this evil spirit out. But you'll notice that the treatment of mental illness was connected to how we believed mental illness was caused. So, unfortunately, in this time, a lot of children were put to death because the mental illness that they faced, they could not get out through trephination. They couldn't get out through a form of exorcism or whatnot. So that was all the way back in the times of ancient Greece and Roman society. Now, the general mindset on children was that children were meant to be shaped or molded, and the Puritan spirit was to shape or mold people with harsh punishment. So if a child misbehaved, it was not uncommon for them to be beaten or ignored or shunned by society. So that was the mindset how children were supposed to be treated. So harsh punishment, harsh treatment was pretty common. And if you look in some societies, there were certain laws that allowed children who had developmental disorders to be kept in cages or cellars. And if you think of the concept of an asylum, What was an asylum? Asylum in those days, people who had mental illness were put in like almost a primitive prison where they were shackled against the walls, they were put into dungeon-esque conditions. And if you look at the Bethlehem Hospital in London, that even became a tourist attraction where people would come and pay to see the suffering of the mentally ill. So children who struggled with developmental disabilities, other psychological disorders, they were treated very harshly historically. But there was a shift, right? So there was a shift of social consciousness, people like John Locke. Now, some of you have heard the name John Locke from either other classes or philosophy, because John Locke is famous for the concept called a tabula rasa. And a tabula rasa basically means that we're all born a blank slate, and it's through experience that we acquire knowledge. But John Locke had some really important views on the rights of the individual. He felt that children were meant to be treated with respect, dignity, care. And this was very different than earlier mindsets on how to take care of children. So he rejected the idea of indifference and harsh treatment that we talked about on the previous slide. We also see Jean-Marc Itard focus on care, treatment, and training of children. Even if they had severe developmental delays, they could acquire some knowledge and skills. So you start to see this shift in the mindset or ideology on how we're supposed to take care of children, whether they have a developmental delay or some kind of other mental illness. So fast forward, we have Letta Stetter-Hollingworth. Now, Letta Stetter-Hollingworth is an incredible scholar who pushed back on several things. Well, first of all, she was very interested in intelligence. So she studied intelligence both in the gifted as well as people who had intellectual disabilities, and tried to understand how individuals functioned. She also rejected the male superiority myth. The prevailing attitude was that males were inherently more intelligent than females, and her work on intelligence rejected the male superiority myth, as well as what was called the variability hypothesis in those days. So she pushed back very strongly. But another gift that she gave psychology as a science was the ability to separate or distinguish between those who had an intellectual disorder from those who had some other mental health concern. And our current DSM-5, we're forever grateful, right? The ability to separate cognitive delays versus other mental health concerns versus lumping them all together. Now, Benjamin Rush, he's viewed as the father of American psychiatry. Now, interesting factoid about Benjamin Rush is one of the individuals who signed the Declaration of Independence, which is pretty cool. So, but he was interested in mental health, and one of the points he made was that children were not capable of adult-like insanity. So if you saw childhood disorders, they were more or less what he called a moral insanity, in quotes. And what is a moral insanity? Moral insanity is some kind of character or personality defect. So he didn't believe that children's mental health should be treated the same as adults. And we also see at this time, we see this organic disease model, which emphasized more humane forms of treatment and replace a moral insanity view of psychological disorders. So we're starting to see a shift towards more humane treatment of children with disabilities. All right. So one of the other belief sets that is starting to emerge is that children needed guidance and support. They were not meant to be left to their own devices. Now, the idea of being actively involved in parenting, that was an important point, because there was a philosopher by the name of Jean-Jacques Rousseau. Rousseau believed in the concept called the noble savage. And the noble savage, the basic belief is that children are inherently good, and if left alone, they will naturally develop in a healthy or proper way. But this mindset is that we need to be involved in guiding and shaping children. So let's start to talk about some of the biological viewpoints. So the somatogenic or biological model suggests that mental disorders were caused by some kind of biological problem. Now, what's interesting is even at the same time where we're pushing the idea that psychological disorders had biological origins, we still had a bias suggesting that the individual who suffered with a mental illness was at fault. So the mental health stigma still existed. So you are the cause of your own mental health problems. If it's biological, though, how can you be the cause of your own problems if it's biological in origin? So there are these problematic, contradictory beliefs that are happening in the late 19th century. Now, another major player is Clifford Beers. Clifford Beers actually wrote an autobiography of his experience of mental health treatment. And he struggled with mental health problems, and his parents put him in one psychiatric hospital after another. And he was subjected to straitjackets, he was subjected to forced feeding and forced medication. And he wrote a whole book on his experience and how he overcame his mental illness. But the book he wrote, in this book, he put a spotlight on what it was like to be on the inside of a psychiatric hospital. And he really pushed against some of the poor treatment and the harmful practices that were in the early 1900s. So what was his goal? His goal was to raise consciousness to what was happening in these hospitals, increase the standard of care to individuals who are struggling with mental health problems, and to push for a more accurate representation of mental health as a whole. So what's interesting, though, is that in the early 1900s, we also see that the state hospital system is taking off. Now, there is a woman by the name of Dorothea Dix who advocated to Congress that the asylums, the old asylums that I described, there's a lot of problems with. So instead, we should have state-run, state-supervised hospitals. And the belief was that if we had these state-run hospitals, people would get better treatment because of the oversight. The problem is that it resulted in overcrowding, underfunding, and ultimately we see that the state-run hospitals regress into asylums, and they wind up being places where people were institutionalized for their whole life. So some of the practices in institutions at the time of the early 1900s was that if a person had an intellectual disability, there were states that allowed the process of sterilization, right? So you could sterilize a child who had an intellectual disability so that they couldn't procreate, because there was a belief in eugenics of how these things are passed through the genes, and they wanted to purify the genes, so to speak. Very, very popular in late 1800s, early 1900s. So yeah, people would be institutionalized, they would be sterilized, and that was meant to protect society. And I put protect society in quotes because these individuals wound up being in institutions for the rest of their life and subjected to some really not so nice treatment, as Clifford Bears talked about too. So there was also a movement for a psychogenic model. A psychogenic model was the belief that mental health problems originate through psychological means, right? So mental health problems have psychological origins. And we see two major theoretical models in the early 1900s that really push us forward. So we have the psychoanalytic model or psychoanalytic theory, and we have the behaviorists. And I'm going to talk a very brief, very cursory description of psychoanalytic theory and behaviorism. If you're interested, I do have some videos, hour-and-a-half videos describing each of these models, so you can get greater richness in another one of my videos. So let's talk about psychoanalysis. So psychoanalysis, the originator was Sigmund Freud. So Sigmund Freud believed that we're born with basic drives and predispositions that impact our development. And the two basic drives are sex and aggression. And Freud came up with what's called the psychosexual stage theory of development. So if a person does not, or if a child does not go through these psychosexual stages properly, it is possible that they will be prone to mental health problems. So proper development is the avoidance of neurosis, avoidance of mental health problems. Whereas if you developed a fixation in any one of Freud's stages, he felt that you would get stuck and it could cause a whole host of problems. Now, Sigmund Freud, his model was created on adults, but this lecture is about children. Now, what's interesting is that Anna Freud, which was Sigmund Freud's daughter, created some of the early child study clinics, and she was able to validate some of his ideas in children. And she looked at developmental stages and how a child is developing within a certain developmental stage is going to be predictive of mental health or mental illness. So that's Sigmund Freud. So basic drives, Anna Freud actually also introduced some concepts of the defense mechanisms that we know. Also another rock star in the history of psychology. The competing force was behaviorism, though. Behaviorism was directly opposed to psychoanalysis because psychoanalysis put a strong emphasis on the unconscious, and behaviorists felt that the unconscious is analogous to the soul. Just like one cannot physically measure the soul, one cannot measure the unconscious. So behaviorists put an emphasis on directly observable behavior. And as a function of this, a lot of what we refer to as evidence-based treatment for children and families can be traced to behaviorism. Now, there are several players that I do want you to know. Pavlov. Now, Pavlov did research on classical conditioning. The general premise of classical conditioning is that if we pair two stimuli together, we make an association. And in his early studies with dogs, he could make you associate a ringing of a bell with the presence of food, to the point where you would salivate to ringing of a bell as if you were presented food. That's classical conditioning. Now, John Watson wanted to take Pavlov's ideas of classical conditioning and apply it to children. And he developed a belief that classical conditioning could be used to treat fear in children. So he designed a study, what we refer to as the Little Albert study, in which he took an infant and through classical conditioning, he linked the sound of a crowbar with the presence of a white rat. And little Albert initially was not afraid of the white rat, but as soon as he kept hearing the crashing of these iron bars and then the presentation of the white rat, he eventually started to become afraid of the rat, a bunny, anything that was similar. Now, Watson is criticized for this study. So he it's considered one of the unethical studies because a child can't consent to this. However, that doesn't mean that his ideas were completely incorrect, because Mary Cover Jones took the ideas that Watson was doing and was able to decondition fear. So behaviorism was effective. Now, I just want to make sure that the order is clear, because I think I may have said it in a way that is misleading. In the Watson studies, you would present the white rat followed by a loud noise that startles. And if you pair the white rat with the loud noise over and over and over, eventually you're going to become afraid of the white rat. So in the association, the white rat came before the loud noise. I just want to make sure that's clear as well. Now, then we have people like Jean Piaget and Lev Vygotsky. These are two of our leading figures when we talk about cognitive development. So how we develop a worldview, how we learn. And Piaget suggested that all children go through 4 stages of cognitive development, starting with sensory motor, pre-operational thought, concrete operational thought, and then ultimately formal operational thought. So sensory motor, we explore our environment through sensory means. Then pre-operational thought is basically pre-logical thinking, where a child believes in things like superstitions and magical thinking and things like that. But by the time a child gets to grade school, they tend to be more concrete, follow basic rules of logic. And then when they get to about adolescence, they start to have abstract reasoning. Now, Piaget was different than Vygotsky because Piaget believed that all children grow through the same process, whereas Vygotsky believed that your environment and the active instruction of adults can shape the cognitive development of a child. So that's that model. And then we also have Uri Bronfenbrenner, who talks about the ecological systems model. And on the right, you'll see a picture of his model. And he basically said the child has a microsystem. And the microsystem these are the systems within the child's environment that they're directly connected to. So your family, your school, your peers, your neighborhood, and so forth. The mesosystem is the interconnection of all of the microsystems. So the connection between the family and a school, the connection between the family and, let's say, a church group, etc. Now, the exosystem, exo means more outermost, right? So Now, this system doesn't have direct contact with the individual. It's more of an indirect contact. So, for example, a parent's job, right? If a parent loses a job, it affects the child, but the child is not directly coming into contact with their parents' workplace, so to speak. And then we have the macro system, which is more large scale cultural values and attitudes. And then the chrono system, or the zeitgeist. So we're born into a time period. That time period has a set of beliefs that could affect the development of a child. So these are the various systems. Now, if we were to look historically, between the 1930s through the 1950s, we do see a very strong influence of psychoanalysis. So psychodynamic approaches were the prevailing approach. Now, not entirely connected to the psychoanalytic approach, but we do see in this time period a lot of children who had an intellectual disability or who had other psychological disorders. They were institutionalized, as we talked about in the early 1900s. Now, Spitz did a series of research studies that showed, similar to Clifford Beers, that institutional life was harmful to children, was harmful to their development. So we do see a wave of institutionalization decreasing. So if you look on the right, here's a graph of institutionalization in public mental hospitals, and you see that it peaks in the mid 1950s and then starts to drop off significantly. So institutionalization did decrease. And then by the 1960s, we see behaviorism start to take over as one of the major approaches in treating the child and the family. So that becomes a more prominent form of therapy, certainly in the States. This is the last thing I want you to think about, is that in addition to what's happening generally in these psychological models, society is changing, and we start to see legislative action to reflect the changing in attitudes. So the attitudes that were pushed for fair treatment or egalitarian treatment of children is reflected in some of our laws. So we see that we have the Individuals with Disabilities Education Act, or IDEA. The IDEA requires there to be free and appropriate public education for children who have special needs. And it has to be in the least restrictive environment. What do I mean by that? Depending on the child's level of competence, depending on the level of the disability, we try and provide as much of an inclusive environment as similar as possible to a mainstream classroom as possible. So in special education, you might hear the phrase a 6-to-1 classroom, an 8-to-1, a 12-to-1. You might hear a collaborative classroom where there's a special education teacher as well as a regular education in the same classroom. And then you have the concept of quote unquote mainstreaming. So there is this process. If a child can benefit from an integrated classroom, we do not put them in a restrictive environment of a 6-to-1. A 6-to-1 would be 6 kids to 1 teacher. That is the most restrictive, because that the belief is that the disability is so strong and impactful, they need more oversight. Whereas a mainstream classroom, this child may have a disability, might have what's called a 504 plan, but they're still able to function in the classroom properly. So we have to give appropriate and free education to children with special needs. We also have to give them the closest approximation to a mainstream classroom as possible. Children who have disabilities are entitled to appropriate assessment. And what we mean by appropriate is that it has to be validated instruments. That's one level of appropriateness. And we also have to make sure that the tests are culturally appropriate as well. Last but not least, the result of an assessment might lead to what's called an IEP, or an individualized education plan, where there are specific target goals, maybe in speech, education, occupational therapy, and so forth, to help the child function fully in the classroom. So that is a very quick march through the history of the treatment of mental illness and the treatment of children who struggle from intellectual and mental health problems. With that, I will stop. If you like this content, find it meaningful, hit the like button, subscribe, click the notifications tab. That will allow you to gain access to all of my videos, know when I post a new one, as well as it allows YouTube to do through their algorithm and say, okay, this is useful, we'll push it out to a larger audience. Thank you very much. Until next time, take care, everybody.